The next protocol we're going to talk about is a new protocol for us. It's called the Care for the Agitated Patient Protocol. I think this one will be really useful. I think it's been needed for a long time. Um, so we'll just kind of jump right in right here. So this protocol actually has a couple different parts to it, so we'll just kind of start at the beginning. Um, this is kind of talking about patients that are like agitated, kind of prevents them from getting the appropriate care, life-saving treatments, or being monitored appropriately. So the first part kind of describes those patients, and then tells you like the general care for it. It also notes that agitation itself may be a symptom of a serious medical condition. I think that's an important thing for all of us to remember when we're dealing with these kinds of patients, because it is frustrating when you think uh, somebody is just aggravated and not complying, but that can be a symptom of something going on, whether that's a mental health illness or if it's something else going on. So, an important thing to remember is that you have to absolutely check these patients' vital signs as long as it's safe to do so. Um, you should evaluate for any kind of neurological deficits. Um, if you can do that, you should do it with a stroke scale. Our stroke protocol says to do the Cincinnati stroke scale, so that would be the one that I would use. You should try and make sure there's no evidence of any seizure activity. And that's not necessarily like the grand mal seizures that we're used to seeing. It could be just, some repetitive movements of the eyes or face, anything like that could be considered seizure activity. You also want to make sure there's no signs of trauma, or try and look for any sign of trauma, especially head trauma or hemorrhage, anything that might alter their mental status. Um, Kind of want to make sure you look for signs of infection, whether that's like neck stiffness, kind of thinking about meningitis or fever. It's kind of going down like the sepsis road, because sepsis can lead to altered mental status. We've all seen it when the little old ladies that get UTIs and they get septic from it. A lot of times it'll alter their mental status. Doesn't always make them to the point they're combative, but it does from time to time alter their mental status to that point. The next part of this part of the protocol is extremely important. You need to make sure you obtain a history of the event from bystanders or family on scene if possible. This could be the only opportunity that anybody with a medical background gets to obtain that history. Sometimes, these events happen in public and it's just some bystanders, and, they don't know the person, so they may not follow them up. They probably won't follow them up to the hospital, honestly. And oftentimes the family don't follow them to the hospital either, just because it's also frustrating for them. So just make sure you get a good history from any bystanders or family that may be present on the scene. At the bottom of this page, it makes it very clear that you should never transport a patient in the prone position, because it restricts airway patency, restricts chest movement, and the patient's overall ability to breathe. So, not that anybody at Ambulance Inc. is doing that or ever has done that, really. I don't think I've ever seen it, but there are places out there that have done it. It's come back and been some pretty big legal issues coming from it, and you don't want to open yourself up to a lawsuit. So if you have patients that you have to restrain a little bit, um, or are agitated, just make sure you're transporting them not in the prone position, preferably like semi-Fowlers or supine. All right, so the next part of this protocol is for just very mild agitation. So this is somebody who has a change from their baseline mental state, is uncomfortable, they are able to understand instructions and comply with requests, and can consent to treatment. So your first option for treatment is going to be provide reassurance and try to verbally de-escalate the situation. But if that doesn't work, paramedics, you guys can give them 1 to 2 milligrams of IV Versed if their agitation doesn't improve. Also, while we're looking at a protocol formatted like this, I just wanted to let you guys know that uh, all of the new protocol, not all of the new protocols, but the new ones that we didn't have a protocol for in the last set are formatted like this. It doesn't differentiate or isolate the EMT protocol from the advanced EMT from the paramedic protocols. So it's important to remember when you're looking at something formatted like this that you can only do what's in your scope of practice. So even though it doesn't explicitly state on this protocol, uh, only paramedics are allowed to give Versed. So advanced EMTs can't, EMTs can't. So just remember that when you're looking at stuff like this in the future. I think from now on, this is pretty much what the protocols are going to look like as far as format goes. So just remember that when you look at them in the future, okay?